Early on in life, I was fascinated by the human body, how it works, the diseases, how to fix them, the biochemistry. So as a kid, I was reading, textbooks, and I was fascinated by medicine and everything around it. My name is Emmanuel Gibon. I'm an orthopedic surgeon here at Penn Medicine. I do a very broad range of procedures from primary hip and knee replacement in patients with osteoarthritis or other conditions requiring a joint replacement. I also do partial joint replacement, and I also take care of patients who had their joint replacement done elsewhere and they want to establish care. When a patient comes to see me, I like to take a detailed history, listening to their complaint. How long has it been going on for, what's troubled them, what is their disability. I will be doing a thorough physical exams, looking at their hip, their knee, and any other painful area of their body. And then we'll look at the x-rays together, images by images, and tell them the diagnosis, what they can expect for treatment, whether or not it's surgical, and then we'll discuss more about the expectations and the timeline of the treatment. When a patient is stressed or has a lot of concern for the procedure, I think it's important to take time and go through the plan of care again with expectations of every step of the way and being able to answer their questions in ways that everything is clear in their mind. So I think it comes with good or excellent communication. The joint replacement division at Penn has access to state-of-the-art technology, which allows us to make procedures extremely accurate and reliable and predictable. And the resources that Penn gives us allows us to achieve excellent outcomes. And it's not only one technology, it's various technologies from different manufacturers that we have access to. It gives us the options to choose the right implant for the right procedure and for the right patients. And that's invaluable. Joint replacement is extremely rewarding because we can give patients their life back, their mobility back as well. They can enjoy golfing or going to the gym, and they can move around, painless. And we can witness that, and it's extremely rewarding.